so much, Dr. Singer. Well, good afternoon, everyone. My name is Denise Schimming. I am an advanced practice registered nurse at the James Cancer Hospital, and I'm also the Associate Director of Survivorship and Cancer Support Services. Today, I was excited when Dr. Singer asked me to come and speak because this is really something that is often overlooked in cancer care. Supportive care, survivorship services are available to you and your loved ones, whether you're newly diagnosed, active in treatment, or you've completed treatment, or you're navigating your new life after cancer. Our goal is really to empower you with tools, resources, and support to live well, not only just survive. So kind of before I get started, just to give me an idea, how many people in this room are actually patients receiving treatment, newly diagnosed, or after treatment? Okay. How many are caregivers or are here to support their loved ones? So it's half and half, really, which is phenomenal and just a really true example of how much cancer impacts everybody, not just the patient themselves. The objectives for today's session are really pretty straightforward. First, I want to give you an overview of supportive services we have here at the James Cancer Hospital. Second, I'll explain how to navigate and access these services so you and your loved ones can make the most of them. And finally, I'm going to highlight how these programs are designed to support the whole person, addressing physical, emotional, practical, spiritual needs throughout your cancer journey. This is informal, so I am okay if someone raises their hands and has a question, as we're going through. So specifically, a cancer diagnosis impacts far more than just your physical health. It touches every part of life, from your mental and emotional well-being, your relationships, your finances, and your day-to-day activities. It also deeply affects loved ones and caregivers, and our supportive care team understands these challenges, and we're really here to walk beside you through every stage of your journey. Our goal is to help manage these issues you face during and after treatment, and ultimately your quality of life. Supportive care is about making sure you have the tools, resources, and confidence to live well beyond a cancer diagnosis. So kind of where does this all start? Well, one of the key approaches that we have here at the James is the Survivorship Clinic. And I tell all patients that you are eligible for a survivorship clinic anytime from day of diagnosis throughout 20 years after you've completed cancer treatment. I actually just saw a woman this week who was done with treatment 2 years ago and was really still struggling with some aspects that she didn't deal with towards the end of treatment and was now feeling like things weren't getting better and she needed some resources. So this is open at any point in time. And what happens when you come to the survivorship clinic is you meet with a nurse practitioner or an advanced practice provider like myself, and we just really have a conversation. We talk about questions about how you're doing. I had a lady just this week say to me, "You're the first person to really ask me how I'm doing." And I've seen a surgeon, I've seen a medical oncologist, I've seen a radiation oncologist. But we talk about all the physical, emotion, and spiritual and practical changes that can occur. So as you can anticipate, each visit's going to be different because the needs are different for each patient that I meet. We use something called a supportive care screen, and it's a big word, but it's just a document, a front and a back, that really breaks down how someone is doing physically, mentally, emotionally, and spiritually, like I had mentioned. We ask some questions, and then I use that tool to kind of tailor my discussion with that patient specifically. These visits are scheduled for an hour. So sometimes a patient just really wants to talk about their new diagnosis and the stage and what type of cancer they have. Sometimes they're towards the end of treatment, they want to talk about goal setting and how do they really move forward after their diagnosis. So these visits are geared towards what you need at that point in time. We provide a lot of health education, so that can look different at the beginning and the end of treatment, of course. And what I have found is at the end of treatment, patients come to this visit really wanting to know, how do I move forward and what healthy lifestyle recommendations can I do to improve? So it's a lot about diet, exercise, stress management, tobacco cessation, finding out what they're doing currently in their lives and how can we make small changes, and then supporting them and giving them resources to make those changes. So education and James resources is definitely a big thing. I mentioned seeing patients at the end of treatment, and one thing that we do also provide is called a treatment summary and survivorship care plan after treatment. It's a long word, but really that's a document that outlines your cancer journey. There's about 80 variables on this document that are geared specifically towards you. A little bit about that document is it lists your whole care team. So it could be your surgeon, your medical oncologist, your radiation oncologist. And then the second part of that document is all of your pathology and treatment, right? So what type of cancer do you have? How large was it? Where there's their lymph node involvement? What stage are you? Did you have chemotherapy, immunotherapy? What were those specific agents? How long will you be on them? How many doses did you potentially receive with radiation particular? How many centigrays? The next section talks about your genetic testing. Have you had it? What were the results? And then the parts after that kind of are tailored specifically to you to know what kind of follow-up you're going to have moving forward. Who's going to see you, what docs, what scans, what blood work, so that you have an idea of what the next steps will be, followed by that healthy lifestyle that I had just mentioned. A lot of times at this visit, and if it is at the end of treatment, patients are very motivated to make goals moving forward that they can work on. So say I see someone that is not active at all, and they'll say to me, I'm not active, I don't do anything whatsoever. We'll kind of come with some ideas about how could they start. Maybe it's 5 minutes a day. Maybe it's a class that they can participate in, which I'll kind of talk about in a little bit. Based on that survivorship visit, I then kind of tailor it to which one of these cancer support services or resources could be beneficial to the patient. So in particular, I always like to talk to the patients, are you a group person? Do you like individual stuff? Because right away you can tell if someone wants to participate in groups or is more of a one-on-one. And then also we'll talk about whether or not they like virtual or in-person. Because we offer a lot of things virtually now with COVID. COVID didn't bring many positive things, but it did turn our whole department virtual. So you can even meet with a nurse practitioner like myself virtually, because you guys have, burdens of all these appointments and things you need to go to. And this is definitely something we don't want to make more of a burden for you. But physical therapy, I don't know if you knew that physical therapy can really help with range of motion, lymphedema, impaired mobility, chemo and radiation side effects, and fatigue. So if someone talks to me about fatigue, I can set them up with PT. OT the same, a lot of fatigue and cognitive changes, especially also neuropathy, that numbness and tingling that you can experience from some of the agents we use to treat cancer. Nutrition or dietitian. Sometimes it's patients are losing weight during treatment. Sometimes they want healthy lifestyle recommendations after treatment, but a meeting with our nutritionist is a free service for you at any point in time during your cancer journey. I want to spend a little bit of time talking about this psychosocial support, because this is a big one. It's the number one thing that I hear when I meet with patients, that they have concerns about why did they get cancer, how it's impacting their family members. They have anxiety, distress, depression, all correlated around the diagnosis. And what I do is ask questions to kind of delve in where they're at in their juncture, and then I talk about resources. And the big ones that you are eligible for is one-on-one counseling with our social workers, our psychologists. We have 3 psychiatric nurse practitioners in my group that do medication management for cancer-related distress. And we also have art and music therapy, which have been proven to help patients with coping. So if you're somebody that says to me, I don't want counseling, I tried it once, it didn't work. Well, are you someone that wants to try a medication? Then I would kind of refer you to the psychiatric APP route. If you're somebody that says to me, no, I do not want to start a pill, I want to deal with this on my own, counseling, so I would maybe refer you to our counselors or our art or music. And keep in mind, all of these services are virtual, like I mentioned before, which makes it easier for you to do at your home. One other thing is our harm reduction counseling. Really, this is to help quitting habits that are harmful to your health. An example would be someone who is smoking that would like to quit, somebody that is abusing alcohol or drugs. We have a special counselor that's trained in how to deal with those for patients. And then the other big one is our sexual health, which is something we don't really talk a lot about, is our sexual health and fertility. But we know decreased libido, or the drive to have sex, our body images, our physical symptoms that are impacting us, the fatigue we have from treatment that gives us no energy to have sex with our partners. This is something that we really try to talk about and make it an okay environment for patients to talk about those issues and needs. We have a special psychiatric counselor that specializes in sex therapy. We have our male nurse practitioner who does erectile dysfunction medications for patients and low testosterone. For our women, we have a clinic specifically geared towards sexual health issues for women, so we have both of those as well. Integrative oncology, it's really just complementary and holistic approach to health and wellness. So if a patient says to me, I'm looking for more tools to help me relax, acupuncture, massage, they're also within our department. And then the other is genetics, and we talked about some of these earlier today, the genetics program. So how do you get that survivorship appointment? So I would say there's a couple of ways. First is you can self-schedule. I listed the phone number on here. It's 366-8700. You're welcome to call anytime and say, hey, I'm a patient at the James. I really want to meet with a survivorship nurse practitioner via telehealth or via in-person, and we can get that scheduled for you. You can also ask your provider. So any of the providers here at the James can put in a referral for the survivorship clinic. And I would just like to reiterate that you can be seen at any time, from day of diagnosis throughout one's life. So at any point in time, this is a service that you can find. And think about the survivorship bucket as almost like the gatekeeper to all those services that I listed underneath there and talked about, right? You're eligible for any of those, but when you come and meet with that nurse practitioner, it's a holistic needs assessment where they're really listening to you, figuring out what your needs are, and then plugging you into the appropriate resources based on your needs. You all know how big Ohio State is and how difficult it is to navigate. That's kind of what we try to help with, is pointing those things and getting you where you need to go. During the break, I did sit these on a lot of the ends, and I have a ton, so if anybody needs more, I just wanted to take a few minutes to talk about James Care for Life. So James Care for Life is really, it's a program that focuses on the many ways life is impacted by cancer diagnosis, and they're designed to empower survivors and caregivers by providing education, support, and coping tools. Everything in this brochure is free of charge. So I see a lot of patients who are impacted by the financial burden of cancer, and they have no more money to do any more appointments, and they're looking for still resources. This is the best tool that I have for them because everything in here is free. It is also, you're able to bring not only yourself, the patient, we allow you to bring your caregivers. That's kind of why I asked in here how many caregivers were in this room, because if you participate in anything, a yoga class, a Balance for Life class, you can bring your significant other, friend, neighbor, whoever with you to these classes. So you'll see there's descriptions, and just for time, I can't go over all of them, but we have exercise programs, education programs, nutrition programs, expressive art programs, mind, body, and spirit programs, our family, team, and children's programs, and I just want to take a minute to talk about that because that's a fairly new thing. When I was doing those assessments with patients, there's a question that we ask, are you concerned about how your family or friends are coping? And probably 50% of the time, patients would circle yes, and their family member was in the room and they're like, I had no idea you were worried about me. They are. They're worried about how this is impacting the time of their loved ones, the appointments, the stress it's putting on them as the caregiver, driving to appointments, taking on more chores at the house, more family responsibilities. And so since that time, we've now offered caregiver counseling. So that psychosocial support that I talked about earlier, you're able to call that phone number and say, I'm the caregiver of Mr. Smith, and I'd like to have my own caregiver, my own counseling. We are providing that now, and patients and their family members are really taking advantage of it, and it's been very, very impactful for families. The other part, when they would circle that yes, I'm concerned about how my family and friends are coping with my diagnosis, it would be things like, I'm a grandpa, and I'm worried to tell my granddaughter that my cancer's returned and I'm probably not gonna be here in a year. Or, I'm a grandmother, I'm gonna lose my hair, and I'm really concerned about what my grandkids are gonna think of me. Or I'm the mother and father, and I don't know how to tell my child I have cancer. And I'm gonna be completely honest, that's not something I knew how to talk about, right? How can I be giving them advice? So we kind of went to the drawing board, and now we have 2 certified child life specialists that I can refer patients and their family members to have those discussions. Because that discussion with a 3-year-old is gonna be different than a 13-year-old. So what I'll do is connect you with our child life, and we do a lot of video visits with that or in person based on your need to really help you navigate having those hard conversations. The only other thing I kind of wanted to talk about with these James Care for Life programs is on this screen are the most highly utilized. I'm not gonna go through them, but if you wanna take a screenshot, you can. The Healthy Eating for the Cancer Survivor is a phenomenal 1-hour class that they do over lunch a lot. They call them these lunch and learns, where you're able to just hop on and listen to the latest and greatest on nutrition and what you should be doing to or try to do. So if a patient wants to meet with a nutritionist, I can do that, and it can be a one-on-one, or I'll recommend them listening to this specific lunch and learn. The exercise programs are huge. People love the gentle yoga. They love our balance series. I would throw in, if you don't like group classes, but you're really interested in exercise, we do offer our James Care, our physical therapy department will do what we call our James Exercise Program, where you can meet once a week for 4 weeks with our therapist, and they meet you where you're at, right? So maybe you're somebody that's not working out. They'll look at your endurance, your energy level, and they'll come up with a program that you can do then on your own at home. So the goal of this is to meet you and the PT 4 times, once a week for 4, and then you go and carry this out on your own. Okay, so that's a nice one if you're looking for more of a tailored approach for just you specifically and not a group. A couple other big ones I just want to highlight is our Garden of Hope, and that's actually in this brochure. So I think just about everything I'm talking about is in here. But specifically, it is, okay, it's on this trifold here, the Garden of Hope. And I want to just mention that because this is a program where you harvest fresh produce and provided nutritional information from one of our dietitians. It's one-on-one, and you're eligible for free produce at our OSU Waterman Farms, which is only like a mile from here, for 2 years during your treatment. So, it's expensive to eat healthy and to prepare those types of foods, but you go out to the farm, you can get free fresh produce multiple times throughout the season, and you can prepare it on your own, and then also learn from the nutritionist the best ways to be able to utilize that. The other big one I wanted to highlight was the HOPE program, which is helping others through peer experience. And it's exactly what it sounds like. Say you're trying to decide whether or not you want to try this new therapy, or you want to talk to somebody who's had radiation to the brain before, and how did they cope with it, and what were some side effects, or how do I prepare for those sessions. We have 49 patients with different disease groups and different experiences that we pair you up with, that you guys meet and talk about how their experience was, ask questions, and maybe even help you make decisions that you're struggling with internally. And you're having those discussions with your providers, but sometimes you want to talk to somebody who's actually been through that. And then we also have our James Grief Support programs. This slide here is just really to show you all those free programs, how you can register. You can go to the website, you can call. There's multiple ways that you can get involved with those. I just want to highlight our Bob Crane Community Center. So we just opened in April, and it's our new location for James Supportive Care. It's Upper Arlington Bob Crane Community Center. It's on Tremont Road. It's 3200. We're on the 2nd floor there. Kind of one side of the hallway is all of our clinical settings. So it's our therapists, our nurse practitioners, our art, our music, our counselors, our PT department. And then the opposite side of the hall down there is all of our programs. So we have a new demonstration kitchen, a computer lab, PT space. So all of this for this programming space is it's unbelievable, the amount of space we now have to provide patients with these free services. So really, in closing, I just really want to emphasize that cancer care is about so much more than medical treatment. Supportive care plays a vital role in helping you and your loved ones live well, physically, emotionally, and spiritually, both during and after treatment, because those are 2 really difficult times for patients right away. And who would think at the end of treatment it is, but it is. And for some, end of treatment is forever, because they are going to be going through treatment the rest of their lives. But those are the 2 times when patients, really need the most. These services really exist to empower you, support you, and remind you that you're never alone in this journey. I encourage you to take advantage of them. I encourage you to explore what's available and, reach out when you do need help, because there are so many underutilized resources that we have here at the James. So thank you for your time today, and thank you for allowing me to be a part of your journey.